Hello, I'm Dr. Brandt Gibson, and this afternoon I want to talk to you about onychomycosis or fungal toenails. And I'm going to do that again with the 4 questions. Number 1, what is onychomycosis? Well, onychomycosis is an infection of the toenail. It's basically a fungal infection. It can have secondarily bacterial infection or other things associated, but it really is a fungal infection. So what happens is you get an injury of some sort to the nail. The fungus gets in the nail and then it starts to live there and starts to grow and actually do some of those kind of things. And so what will happen is the nail will get thick, it will get discolored. You can sometimes get so it's actually crumbly underneath. All of those things are part of the onychomycosis or fungal toenail. This fungus that causes the onychomycosis is the same fungus that causes athlete's foot. So a lot of times it will be associated with tinea pedis or athlete's foot. Number 2 is, why does it happen? And I kind of covered that a little bit, where it's actually an infection. It's usually either from injury to the nail or some immunosuppression so that you actually get the infection in that nail. Number 3 is, what can you do for it at home? The bad news is there's not a lot of effective treatments for onychomycosis. If you go search the internet, you're going to find all kinds of weird treatments, all kinds of strange things. Some of them may work, most of them do not. I've had patients ask me about soaking in Clorox. I don't recommend that. It probably would kill a fungus, but it actually does pretty good damage to the other tissues as well, including the skin. I've had people actually use Listerine, for example. Again, it was quite effective at helping you treat the fungus because of the alcohol and so forth that's in it, but it actually discolors the nail. So again, I probably wouldn't do that either. So there are some treatments like say doing a melaleuca or tea tree oil to the nail. Sometimes it's quite effective at treating that nail and can actually help in that way. So that is something you can actually consider. Really, most of the rest of the topicals, most of the rest of the things like that don't really work. Number 4 is, when should you go see the doctor? If you're saying, okay, this is becoming a problem, because typically a fungal nail could be a single nail, or it can actually spread to all the nails. If it goes untreated, a lot of times it can get worse and start to spread to other tissues, or you start to say, okay, I'm getting an athlete's foot that I treat and then it comes back, and then I treat it and it comes back because of the fungus in the toenail. So you need to treat the fungus in the toenail to get rid of the athlete's foot too. So in that case, there are things that can be done. There are really 3 treatments that have been shown to help. Number 1 is an oral medication, Lamisil being the primary oral medication that works. It's taken once a day for 3 months. It's actually very, very effective. In some of their initial studies, they have some liver side effects, so a lot of times people are a little bit concerned about that. The truth is, in most cases, there are no liver side effects. It's actually been removed even from a necessary labeling problem because it very rarely is needed. If you're worried about that, you can actually have a blood test drawn at the beginning before you start. You can have it drawn 6 weeks in, and a lot of times if you say, okay, it's starting to affect my liver, you can stop at that point and the liver will go back to normal. Number 2, treatment-wise, there are some topicals that do work. They're relatively ineffective in some cases. Best case scenario, you're gonna get 60% effectiveness. And you paint them on the nail, usually requires painting it twice a day, and it has to be a liquid that will actually penetrate the nail. Number 3, there are some types of lasers that can actually work for treating fungal toenails. Not all lasers work, so it's not not a matter of just saying, okay, I'm gonna go find someone that has a laser and have them treat my toenails and have it go away. They don't always work. So I figured that would just give you some general information about onychomycosis. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 156, fungal toenails or onychomycosis.